Today we are going to be learning about the periodontium. We're wrapping it up. We have learned about enamel, learned about dentin, and now we're going to learn about the rest of it. The alveolar bone, the periodontal ligament, the cementum. We're ready to wrap this up, man. I'm a dental hygiene student. Let's talk about it. The parts of the periodontium. Like I said, you have the gingiva, the alveolar bone, the periodontal ligament, and the cementum. We're just going to talk about this stuff right here, majority. Alveolar bone is your jawbone, right? That is what holds your teeth. There are 3 layers of the alveolar bone. You have alveolar bone proper, which is like the lining of the tooth socket, which here's what I found out. The lamina dura is what you call the alveolar bone proper in an x-ray. So it's the same thing, except here, when you're learning about it in the periodontium or periodontology, which right now we're in oral bio, but whatever. It's the lamina dura and alveolar bone proper. It's the same thing. You have your cortical bone. That is the hard bone. That's gonna be like the bottom layer of the jaw and the top layer of the alveolar bone. Like my little friend here, this would be hard bone up top, and then on the inside, in between, that's gonna be cancellous or spongy, right? And then that bottom of the ridge, so like you have a top and the bottom, that bottom part is the cortical, the hard bone, the compact bone. And like I said, the spongy bone right here, if you can tell, it's cancellous, spongy, lattice. So now we're gonna talk about the PDL. The PDL is the space right in between there that connects the cementum of the tooth to the alveolar bone. It supports it. It takes all the pressure and the pain and it holds that sucker in there. It also gives it nutrients. The cells of the PDL are mainly fibroblasts, right? But it also has collagen fibers and Sharpie fibers. And Sharpie fibers are the fibers that allow the attachment of the PDL to the cementum. Also take note that the PDL can also hold cementoblasts and fibroblasts and osteoblasts. We're gonna keep this really simple. We're gonna use a KISS method. KISS method is keep it simple, stupid. Right now, all you really need to know is the 5 principal fibers, because the rest of them you're gonna learn in periodontology. The 5 principal periodontal ligament fiber is alveolar crest group, horizontal, oblique, apical, and interradicular. That's it right now. What you need to know about this is if you see this in a test question, it is going to say coronal and a group, and it is attaching the cementum to the alveolar bone. Horizontal, if you see this, it's going to say 90 degrees from the alveolar bone to the cementum. And it's inferior to the alveolar crest group, okay? Do you see it? Look at this picture. Alveolar crest group, horizontal. 90 degrees, you see that? Boom. That is going to be right there. Think about that. Then you have the oblique group. That's a given. It's gonna say oblique, but know that it is the most numerous. The oblique group is the most numerous, and it is going oblique. This is the main support of the tooth. So if there's mobility, and there's a question about mobility, it's gonna be this oblique group. There's damage to that. You have our apical group. Apical, it's in the name. It's gonna be right at the apical of the root. Next, interradicular. Know that interradicular is only going to be in furcations. What teeth have furcations? Molars. And some premolars. Which ones? Maxillary. Inter, in between. Think about it. Cementum. Where does a cementum come from? It comes from the dental sac. Remember learning about tooth development? We learned about the enamel organ and the dental papilla, and now we're talking about the dental sac, okay? The dental sac is what makes the cementum. But remember when we talked about enamel and the Herwig root sheath, the Hershey's chocolate, and it melts down. So after the dentin is made, remember the dentin, the primary and secondary layers. So the cementum, it's going to be after the maturation stage, it's kind of towards the end of it, because everything needs to grow in order for the cementum to grow. So now the Hershey's is done with the dentin. It's going to the cementum now. Now that's going to be made. Okay, so acellular, A without cell, right? That is going to be the first layer of cementum. There's two types, acellular and cellular. Acellular is the first layer. That is going to be during the tooth formation and eruption. That is going to be the first layer. It's slow and basically heavier on the cervical third of the root. Then you have the cellular. That is going to be the second layer. It's the fastest. It goes, you know, and covers all the root, but it's more down here apically. So like if like hypercementosis happens, it like anchors the teeth in. Anyway, that is the second layer. It is fast. That happens after tooth eruption and then continuously happens throughout the tooth life. That's why that happens. It contains cementocytes. And then a thing you might need to know is the term OMG, which stands for overlap, meet, and gap. Overlap is when the cementum overlaps the enamel. That happens like 60% of the time. You have the meet, where they meet in the middle like that. That happens about 30% of the time. Then you have where the enamel and cementum are gapped. That happens about 5 to 10% of the time. That like creates more sensitivity because there's, you know, nothing covering the dentin. Cementum is a seal for dental tubules, remember? Anyways, I hope this helped you guys and it helped it make more sense. And I wish you luck and good luck studying. Bye.